So my name is Sarah Marjane. I'm the Executive Director of Partners for Andean Community Health, PACH. I have been with the organization since about 2015, and it has been quite a journey. And one of my favorite things that I do during my day is work with this amazing group of people. So, my personal background, I studied abroad in Ecuador during my undergraduate. I attended the University of Scranton, and then I had the opportunity to go to Ecuador through the International Studies program and attended the university, which one was it? Universidad Espiritu Santo in Guayaquil. And I was there for about a year and I loved it. I absolutely loved it. And just the culture, the food, everything about Ecuador was just enticing. So after I graduated, I went to Peace Corps. I did Peace Corps in Mozambique, where I learned Portuguese and really had a love for international development, community development, grassroots movement, and just really understanding the needs of the community and responding to that. So after that, I went on to get my master's degree in public health and thought that that was one of the basic building blocks of community success. Health, education, and then also obviously community development and economic sustainability. So I worked for a large nonprofit for a number of years in the maternal and child health space, in the HIV/TB space, and then I came across Patch, and I really knew that this was my passion, and I had to do this and had to be there. So I've been with Patch since 2015, and it's been a wonderful journey seeing the institution grow and building relationships and affecting lives in Ecuador.
So you sort of already answered this question, but can you tell me a little bit more about how you became involved with Patch and Fibospam and how you've grown within the organization?
Sure. So I was the first executive director. Prior to me, the team was run completely by the board and volunteers. So it was quite a load to take on this role and become involved. So since its inception, we have grown significantly. So Paul Martel started Patch here in the United States as a vehicle to receive tax-exempt donations to FIBA in Ecuador. And that mission for our organization, as opposed to the mission of FIBA, which is to provide healthcare and sustainable community support in Ecuador, our mission is really to support FIBA and to support the health systems in Ecuador. So that growth has just been amazing. We have gone through many different things. We used to be called FIBA Inc. We changed the patch. We've hired on so many different staffs, been able to engage with different universities and really leverage the capabilities and capacities of many people here in the United States.
Awesome. Cool. Well, so sort of branching off of that, what would you say is the most important part of the work that Patch and Fibospam do in Ecuador?
So I think the most important thing, at least for Patch, is that we're driven by the needs of the community. So we're not the type of institution that is doing medical missions and piloting in and piloting out and not having a sustainable base to understand why people are sick and if after our missions or our interventions took place, if they're doing well, if they're better. So we really rely on our partners, David Guacho, the FIBA team, and others in the communities to tell us what they need. And then it's our job to find doctors, healthcare professionals, IT professionals, whatever it is, to come in and support those needs, whether it's financial resources, technical, or equipment. We exist to serve them and their needs and their service to the community in Ecuador. And I think that's something that really makes us unique. It's different than a lot of other institutions, and we're really driven by the local needs.
Yeah, awesome. And so on that point, what do you think that community members in Riobamba value most about Fibospam's work in the area?
I think they trust us. I
Yeah.
think that that's so important, especially with the indigenous communities. There's so much mistrust with government, with other institutions that have maybe promised something and haven't delivered. I think that they identify with FIBA because many of our staff and our leadership are indigenous and from the communities that we work with. And that level of trust is so important, especially when you're talking about your own personal healthcare or healthcare of your families. And I'm so proud that we continue to deliver and continue to build upon that trust locally.
What do you enjoy most about your work with PACH and FitnessFam? It's kind of a fun question for you.
That's a great question. And I think it's the relationships. It's so much fun to see the relationships between our patients and our local doctors and our traveling physicians, and everything in between. It's great to go back and see patients that we've helped in the past, and they want to visit us. And moreover, they want to be involved in our work. They want to volunteer and they want to help others like they have been helped and supported. And from the side of the traveling doctors and volunteers, we've seen many students come in as medical students or pre-med, and now they're doctors, or they're in their residence, or they're in their career, whatever that might be, and they want to give back and they want to continue relationships. And I think that it's really rare that we have a volunteer that doesn't feel that pull to stay engaged. And I love that. I love working with all different types of people and leveraging the good of all to service.
Yeah, I agree. That's something that's really beautiful about PACH and FitnessFam. Um, so my last question for you is, what is your personal vision of the future for PACH and for FitnessFam over the next few years?
Great, that's a great question. I think it relies on sustainability. So we are so close to sustainability at FIBA-SPAM in Ecuador using the nonprofit hospital model. And we want to continue and drive that home. So we really have a sustainable facility there that can sustain with minimal support from PATCH, and we could really focus on expanding our programs and providing free care to those in the communities that truly need it. So I think that overall, in addition to sustainability and growth, we want to see impact with the healthcare system. We want to see preservation of the culture, the people that we serve, and make sure that they are cared for, and their culture, which is so unique and so lovely, continues to have a place in this world.
Mhm. All right. Well, thank you so much for meeting with me, Sarah. I really appreciate it. Are there any final words that you have to share with the PACH and FIBA-SPAM community?
Just that we really appreciate everyone. We're so excited to work with new volunteers and new students, new folks that are learning about Patch and FIBA-SPAM and what we do. And we're so grateful to our existing volunteers and partners. So just thank you so much. All of this work is made possible by you all, and we're grateful.